Madam, are you there?
Good morning, sir.
Good morning, ma'am.
It was an excellent session. I was in the session also. And to continue with session, the excellence continues where science meets art and where both meets prosthodontist, then it's a smart prosthodontist. So here we welcome a smart prosthodontist to our session, Dr. Rajes Sethuraman. Sir, we welcome you here. We are sure we'll get smarter with the session. And to chair the session, we have two eminent prosthodontists with us, Dr. Rajesh Srivastav, sir, and Dr. Guru Raj Rao. I welcome you both on this platform. A brief introduction for both, though they need no introduction actually. Dr. Rajesh Srivastav, sir, he is a postgraduate from Bapuji Dental College and Hospital and is currently working as Professor and Head, Department of Prosthodontics, Index Institute of Dental Sciences, Indore. The vastness of his knowledge cannot be gauged, but you can still understand the vastness by the number of fellowships he has to his name. He is a fellow of Pierre Fortune Academy. He is a fellow of International Congress of Oral Implantology, fellow of International College of Dentists, diplomate World Congress of Oral Implantology, and besides, Dr. Srivastav has also completed his mastership training program in Smile Design from Dubai. He is a recipient of R.S. Verma Memorial Award as well as Dental GPS World Accredited Mentorship Award in a workshop at Dubai. So we all can understand how accomplished Sir is, and it's definitely an honor to have you, Sir, here on this virtual platform. Sir, once again, I welcome you.
Thank you so much.
To chair the session, so please, on your video, we want to see you also. So, on the second chairperson of this session is Dr. Guru Raj Rao, an undergraduate of A.B. Shetty Memorial Institute of Dental Sciences. He did his post-graduation from the prestigious Savita Dental College, Chennai. He is a thorough academician as well as a clinician. He is a fellow of the International Congress of Oral Implantology, which he completed in 2016. He has also completed his fellowship course in TMD, orofacial pain, and obstructive sleep apnea and dental sleep medicine from Roseman University, USA, in association with Smile USA in 2019. It's a very nice topic. We would love to hear someday from you about this also, sir. So we welcome you here on this platform.
Thank you. Thank you very much.
Dr. Rajesh Sethuraman, I hand over the dais to you now. Before this, we'll have a brief introduction of Dr. Rajesh from our chairpersons.
Thank you, Dr. Shashikala ma'am, for that wonderful introduction. It gives me immense pleasure to introduce the speaker for the day. Dr. Rajesh Sethuraman is currently working as Dean, Professor, Head and PG Guide in Department of Prosthodontics, Crown and Bridge in KM Shah Dental College and Hospitals, Vadodara. He has done his BDS in the year 2000 from GDC Mumbai and MDS in the year 2004 from GDC Nagpur. He completed his DNB in the year 2005. He is a member of the IDA and he's been a member of the Executive Council of the Indian Prosthodontic Society for 3 terms. Currently, he is the Vice President of the Indian Prosthodontic Society and also the President-elect of Indian Prosthodontic Society, Gujarat State Branch. He has conducted various CDE programs at the National IDA and IPS forums, and he's also delivered numerous guest lectures. He has conducted 8 symposiums on complete dentures and fixed prosthodontics across the country. It gives me once again immense pleasure to welcome you, Dr. Rajesh sir. Your introduction is, you don't need any introduction actually. I hand over the podium to you.
Right. Thank you so much. I hope I'm audible enough.
Yes, sir.
Right. That's great. I would at the outset thank Gururaj sir and Rajiv sir for having consented to chair my session. It is an honor to speak in front of both of you, exemplary people in their own fields, and of course with Padiyar sir who made an invitation to me, and Shashikala madam who would be moderating. It really feels that I'm still connected. I'm there, over there at Jaipur. Now, this is what comes immediately to our mind as soon as we think about Jaipur. all of us do know the Hawa Mahal. Now, from this city of the Hawa Mahal, when Padhiyar sir spoke to me and made an invitation, that Rajesh, he often calls me Smarty, and I do not know how Shashikala Jain also picked it up from him. Madam, of course, all of us as prosthodontists are very smart. We are the smartest dentist the world can ever have, because we are the best people who are linked to multidisciplinary dental practice. Fortunately, the patient comes the last to us. So when the patient comes last to us, though the first complaint often is prosthodontic rehab, we treat the patient the last, and therefore we have the wonderful opportunity of jotting down the entire treatment plan, and whether other fellow dentists or specialists agree or not, they 100% will have to follow what we tell them to follow. And therefore, we are already smart. Now, when Padhiyar sir was speaking to me, he said that I would want something which is very different from what we routinely speak. I was happy enough that I had a scientific team, Pragati madam, who also consented and said that, yes, sir, something which would be different, something which the students would, we would motivate them. And I take the entire motivation with respect to choosing of this particular topic from Jaipur's Hawa Mahal. We all know that this is iconic of the place. It's a heritage place. But little do we know that this entire Jharoka setup, which is made, is the backside of the palace. It is not the front of the palace, it is actually the back of the palace. And therefore, this was basically designed not just with aesthetics in mind, but a lot of concept of physics which went into it, biomechanics which went into it. And ultimately, what came out was an aesthetic structure for the queens of Jaipur. Now, when he told to me that I want something which is smart from you, and it should be related to dental materials, what immediately came to my mind is this. Now, when I speak about this, it automatically means dental materials. When we think about, we all would remember the first year dental material class, wherein we were jumped upon, wherein we were just directly bombarded with materials which are used. And we had the instructors and the speakers who loved it, in whose hands the materials worked wonders. And what we used to be only seeing was just seeing them. We never could understand the intricacies because probably they were not presented to us the way it should be presented. They loved it, they were very happy, but we as children just keep looking at the so-called basis of what is presented to us. Therefore, I told him that I will take this opportunity to introduce the students to something which is very close to a prosthodontist's heart, and that is smart materials. And I'm sure materials are damn smart. They're smarter than prosthodontists. Actually speaking, it is because they are smart that we are able to use them, manipulate them if rightly done, and ultimately come to what we become as a smart prosthodontics. What exactly are the smart materials? If I need to tell to you, they are partly water-based. They have their own phases or zones with significant water content, and for which the water within the materials can react to changes in the ambient conditions. Now, what does this mean? They are supposed to be having water-based. Majority of them are. They have got phases, or they may have zones with water content, and for which the water in this particular material has to react with that of the ambient conditions. But there are some materials which do not have water content, but the material itself per se has got intelligent properties and characteristics on basis of which it can act smart. These materials react to changes in the environment to bring about advantageous changes in properties either within the material or in the material tooth complex. And that is why it is necessary that we know about these particular materials so that we can use them, harness them rightly, so that we bring out the advantage that these materials have with respect to it, for which we need to know which are these particular smart materials, what is the smartness that they present, and how we can utilize them in prosthodontics. To begin with, which are a simple classification that actually is there with respect to smart materials, that is, those which exhibit a neutral or a passive behavior, and the others which exhibit a dynamic behavior. Neutral or passive behavior? Yes, we do know that in prosthodontics, majority of our materials or techniques, or whatever we would love, either could be in the passive state or they are in a dynamic state. Materials which are smart also can be neutral or they can be dynamic. A passive or a neutral smart restorative material senses external changes, react to it without an external control, and possess self-repairing characteristics. Now, these are those materials which are passive when they are placed. They sense that there is some kind of change which has occurred, but they did not let the control of the environment take it up. And at the same time, they possess some kind of self-repairing characteristics, as is seen with GICs in all its classes, and of course with a few composites which are nowadays available. Now, when all these particular materials are studied, there was also a class which was introduced or which was seen is that of the active and smart restorative materials. These materials sense hazardous changes in the environment and they respond to them. They see that whatever has come as hazardous, as disadvantageous, is going to have an effect on the tooth, not as well as on the restoration or the tooth restorative complex together. They utilize a biofeedback, a feedback loop, in order to enable them to function as a cognitive response through a control mechanism of system. In this class also we have the glass ionomer the composites, the ceramics, some impression materials, some implant coatings. Though the list is a little bit more, I restrict them only to that of materials, wherein we have got something called as smart burrs, smart mouthwashes, smart, you've got some antimicrobial coatings which are there. All these also together are supposed to be a part of what we call as smart techniques or materials which are available. However, I restrict it specifically to that of restorative materials and why you should choose them with the mechanism of how they work. To begin with, let me start and tell to you as to the choice of our smart impression materials. If you look at impression materials, all of us know the ideal properties. We know that it needs to be hydrophilic to get a very wide free impression. We want to have it having shape memory so that during the elastic recovery, it resists a distortion and gives us a more accurate impression, and toughness which resists tearing. It should have a snap set behavior, which results in precise fitting of the restorations without any distortion. We need to have a cut of the working time and the setting time at least 33%, and at the same time have to have low viscosity and a high flow of the material. Now, all these things put together would make something which is smart, a smart impression material. If you look at the materials which are nowadays available, that is all our elastomers per se, do exhibit a smart phenomenon. They are hydrophilic. We no longer recommend or use hydrophobic materials. We also have a lot of shape memory. There is tear resistance, which is acceptable according to ADA. They have a snap set behavior. I'll explain what it means. And of course, we have got even ultra light flow materials which are available. And of course, pseudo-elasticity, which adds on to contributing a low viscosity to get into the perfect details so that we get smart impression materials. Now, as per the second diagram, that is shown, we all do see that whenever there is a load or a stimulus which is applied to that of an impression material as it is setting, there is some amount of deformation that is going to occur. Now, once that is occurred, as soon as it releases the stresses, as soon as the stimulus is removed, there is a temporary shape fixation, and as soon as we remove it, it cuts back to its original shape. This is its smart shape memory, which is existing in all the elastic materials, and to be very specific, imprint, aquacil, impregam, and the newest type of impression material is polyvinyl ether, which is a combination of polyvinyl siloxane and polyether together, has this particular property. The other smart behavior that impression materials exhibit is the snap set behavior, especially with respect to that of polyether. What does it mean? It means that a material during its working time doesn't sit, which means we get a lot of good amount of working time so that it can be manipulated, mixed, inserted, and we come to a stable position. All this constitutes the working time. And within a fraction, it sets. Now, this particular fraction, wherein you have got the working time ending and the setting time immediately finishing, is what is called as snap set. It just needs to set in a snap. And this snap set behavior is today seen in all, and majority of them are specifically seen with respect to that of polyether impregum, to be more specific, and vinyl polyether. Now, why do you need to know this? What is the clinical significance? The clinical significance is that you need to choose that particular material, which is the best, right? And on basis of all these properties, of course, today we can say that all adhesion silicons, I do not say all of them which have got quadrifunctional groups to make them more hydrophilic, all those which have got snap set behaviors, which is including the polyethers, all those which have got, they all have got shape memory, and of course, good tear resistance and extremely very good amount of flow. Only thing that we need to know is to use them in the right combination, right? Of course, we would, today, we are smart. We know that we don't want to use an impression material at all, and we come onto something which is digital impressions. Believe me, students, believe me, delegates, believe me, chairpersons, the best of amount of literature and the best systematic review on digital impressions does not confirm that digital impression is more superior to our conventional fixed partial denture impressions with respect to that of fit of margins and the precision with which restorations are made. So even though we would still continue with that of conventional prosthodontics, conventional fixed partial denture impressions, we don't have to be ashamed that we are not into digital. We should know. But then if it is not possible or do not have an opportunity to invest into it, do not be. Rest assured that even a conventional fixed partial denture impression made well in the correct type of tray with the correct amount of material that is chosen, you would work out wonders which are similar to that of a digital impression. That's what literature, research, meta-analysis say. We go to the next section, that is the smart restorative materials, and I shall be covering GICs, compomers, and composites. Bioactive cements is something which is new that I introduced to you all. Majority of them may not be knowing it. And of course, our very, very decent, recent friend, Zirconia. GIC, compomers, and composites, all three of them have got an ability to gel. They have a gel structure that can absorb or release solvent rapidly in response to that of a stimulus, thus, which may be temperature or a change in that of the pH, thus making them smart restorative materials. GIC, to be more specific, has got a coefficient of thermal expansion very close to that of dentine. Now, this is one very smart property that we expect in any kind of restorative material. We expect it to be similar to that of tooth structure, to be more precise, dentine. And the reason why I say is because the way a dentine has got a biomechanics, the way a tooth flexes under load, we expect the restorative material which is bonded to it also to move in a similar fashion. Only when this happens can there be success. Otherwise, as my previous presenter, Dr. Anand, said, you are going to result in failures and specifically, to be more specific, caries. Now, our restorative materials, majority of whatever used under the restoration or as a restoration, has got to have an innate property of being smart. They all have to respond to a change in the temperature or change in the or an exposure to that of water and fluids by expanding or contracting, similar to that of dentine, and GIC is smart enough to do this. Along with all these properties, we have always known that GIC has got a fantastic amount of fluoride release. Yes, it releases fluoride so beautifully in such a way that there is an initial rapid early burst of the fluoride from the matrix. And slowly as time goes by, we know that GIC has got a property to dissolve. But as it dissolves, it also is going to provide fluoride which gets released. So therefore, within the mechanism of how GIC is made, we automatically have got an innate mechanism which already exists in it, by virtue of which it prevents recurrent caries. And therefore, today, it has still stood the test of time as a restorative material and as well as that of a luting material. The problem that only glass ionomer cements usually exhibit happens to be with the initial amount of sensitivity that it has, because it initially has got a sensitivity or a pH value of the set cement, which is around 5.5, which is acidic, and therefore the dentine reacts to it slowly, which comes to that of neutral over a long period of time. But this particular problem of GIC has all been solved, which I'll show to you when I come to that of the other CA cements. This is one review which I would expect every student to go through. It's a wonderful review which has opened eyes. It's in Clinical Oral Investigations 2020. It's a fantastic review that says that GIC is supposed to be the material of choice in patients who do exhibit an excessive amount of caries index, or even with those patients who got low socioeconomic status. Leaving socioeconomic status separately, but it has stood the test of time in preventive caries. Believe me, today it is a time-tested material and therefore should be our luting agent of choice whenever we are using any kind of, whenever we are choosing a material which needs to bond to that of the tooth structure at the same time being smart to release fluoride in response to that of its dissolution. So it doesn't react to that of a pH consideration, but it dissolves and releases fluoride. Next, coming on to composite resins, and composite resins are smart because of three basic characteristics that it has. One, remineralizing capability, self-healing capability, and antibacterial capability. To see one by one, how is it remineralizing? Composite resins today, or research has today seen that we add CAP particles, calcium orthophosphate particles, and these are ion-releasing fillers in resin-based composites. Now, these particular ions are released from the composite when the surrounding medium becomes supersaturated, and therefore they deposit these particular calcium and phosphorus ions onto the hydroxyapatite crystals, thus making them more stronger. There are various CAP phases that have been used of bioactive fillers, which may be amorphous calcium phosphate or dicalcium. There are various ones. These are the ones which have been tried and have been found to be successful. And therefore, we today, what is being provided with that of manufacturers happen to be remineralizing this particular capacity, especially when it comes to that of ACP. We all do know that ACP, CPP, which is supposed to be a fantastic casein protein, which is directly taken from that of milk, has been a wonderful revolution with respect to remineralization of tooth structures. Composite resins was not last to take it up, and therefore has incorporated this particular property, making it smart. The next section happens to be on self-healing composites, composite resins, how they can heal themselves. We do know that the oral cavity is subjected to large number of loads, and as loads do happen, we also do know that cracks started. There are lots of surface flaws or Griffith flaws which already may exist. But along with that, we also do know that with load, there are cracks which start and propagate. Now, self-healing composites usually can have either polyurea formaldehyde microcapsules filled with tegma and tertiary amine as an activator, and of course benzoyl peroxide. All these are added. We know that it forms a part of the resin matrix which initiates in polymer. So as you see in the diagram, that you have got a crack which starts. The HP, which happens to be the healing polymer, and HL, which happens to be the healing liquid. Now, these are already present inside the material. They are already there inside the material. And whenever a crack comes and approaches one such kind of a microcapsule, we see that there is a breach, there is a break. The HL, that is a healing liquid which is there inside it, gets released. It reacts with the healing polymer and therefore forms a new material that seals that particular crack, thus making it self-healing. So therefore, whenever you're going to choose a composite which has got to be used in areas wherein high stresses are exhibited, especially with respect to post and core restorations, see to it, wherein aesthetics is not much of a consideration, please see to it that you take such strong composites which have got self-healing considerations. We have got a compomer, which also is supposed to be a combination of GIC and composites together, wherein there we have got silonated silica microcapsules, which are filled with an aqueous solution of polyacrylic acids. There it happens to be the glass ionomer cement, which happens to seal, and therefore it's combined together to make it as compomer, composite with ionomer together, right? Now, the next section of composite resins which are smart are the antimicrobial composites. Now, with respect to any composites, its research is something which is continuing to be changing with day to day and bringing a large number of, especially with the dental materials, because this is the basis on which we are going to live, on which we as prosthodontists thrive. Now, when you look at the various types of materials which have been tried, they have thought that why don't we make materials themselves capable enough that we can wave off or see to it that microbes don't come close. They die as soon as they approach the surface. Therefore, quaternary ammonium or MDPB, or bioactive glass particles, silver nanoparticles, zinc oxide particles, and chlorhexidine, these are all the ones which have been incorporated in different researches into making an antimicrobial composites. Though there has not been much amount of success, but quaternary ammonium, bioactive glasses, silver and zinc oxide nanoparticles, these have shown considerable amount of success in making composites antimicrobial. The mechanism being that once it is there incorporated into the matrix, as soon as microorganism approaches, you have a breach. You see that there is a sense, there is a change in the pH, wherein these antimicrobials get released. They get into contact with that of the microorganism and result in its change in the cation anion concentration inside the cell, leading to a rupture of the cell membrane and death of the microbe cell. This is mechanisms by which composites can be antimicrobial. Though today we do not have one single composites that has got all the three mechanisms of self-healing, antimicrobial, and the one wherein you join all the three capabilities, all the three strategies together, we are having different ones, especially with respect to the one which is self-healing is today present. There is a lot of research going on in dental materials with respect to making them antimicrobial, and we'll surely see the light of the day. This is one thing which I would like to introduce to the delegates as bioactive cements. Please do see to it that you use them, because we have personally used it in the department and it works out wonders, gives fantastic results. This is a new formulation class which has got a hybrid material that combines calcium, aluminate, and glass ionomer components together. Today we have two of them. One is Ceramir and the other one is from Pulpden, that is Activa or bioactive cement. What does it mean? Now, these bioactive cements have got a specific mechanism by which I already told you. It is calcium aluminate and glass ionomer, both of them. Initially, when the cement is mixed, you got the glass ionomer which dominates the reaction. I already told you that there is an initial pH of 5, and within 12 hours, it is supposed to come to 8.5 and even reaches 11, making it totally basic, right? There is a leakage now, therefore, which starts at 12 hours. We see that there is leakage of around strontium and phosphate and during the hardening phase, and ultimately forming something which is a hydroxyapatite-like structure. But on the other hand, we have the calcium aluminate, which is already present into it, which reacts with water and forms a reaction which introduces a dissolution in the precipitation reaction, which ultimately results in two components, kechoite and gibbsite. Both of them result in an immediate fall in the pH and release of the fall in the pH, in the sense they get the pH as high as that possible. Whenever there is a fall in the pH, that is, whenever there is an acid attack, whenever we see that the critical level of 5.5 is breached, we see that there is release of phosphate and carbonate, which together with the leakage of strontium and phosphate from the glass ionomer component, together results in the formation of a hydroxyapatite-like crystal. Believe me, Ceramir C&B and Activa are literally, they result in a post-operative sensitivity of negligibly zero. All the vast scores of the patients whom we treated in our randomized control trial gave us results which were absolutely, they were happy with it. When pure GIC or RNGIC was used, they did complain of sensitivity at the time when the cementation was being done. But however, with respect to the bioactive cements, this particular phenomenon is not there. In addition to this, they also are smart, because with the result in loss of pH, extreme reduction in pH, they release phosphate and carbonate ions to form a hydroxyapatite-like crystal. So therefore, choose these bioactive cements in order to lute your restorations. We come to the last two of them, that is Zirconia and Implants. Smart ceramics, yes, of course, today we all do know, all our researchers with respect to ceramics has bottomed down to that of zirconia. Day in and day two, we have got so many such kinds of materials which are being, or material researchers in order to make zirconia the best material, because today we cannot work on something which is more stronger than this particular material, which has stood the test of time. And however, by virtue of its structure, we already do know that zirconia exists in three basic phases or forms. The basic phase, and along with that, you've got the tetragonal and the monoclinic. These are three ones which are present. And in the after the sintered phase, we today we have got something which is called as yttrium stabilized tetragonal form, which is what our restorations are in that particular form when you are fixing them, luting them in the patient's mouth. Now, how does it work smart? Why is it that this particular material needs to be used? Is because when I have a stress, whether it is because I am reducing it, I'm polishing it, or adjusting the occlusion inside the mouth, or the zirconia is being subjected to that of load. The surface flaws or the Griffith flaws which exist on the surface have got a tendency to propagate inside zirconia. Now, zirconia, being crystallographic in structure, has got a tendency to allow the crack to propagate. And if a crack propagates and reaches till the base, you have got a very visible fracture and failure of the restoration. Blessed is zirconia because it has got a tendency that whenever it is subjected to stress, tetragonal form gets converted into monoclinic form. Now, how exactly is monoclinic beneficial for us? Is because monoclinic form has got a tendency to occupy more amount of space. To be very specific, 4.4% larger space, the crystals become larger in size, and therefore they themselves seal off the crack which is propagating. So to be very specific, if you look at the advancing crack form, all those areas which are all the zirconia crystals, the tetragonal ones which are in the line of that particular crack, start converting themselves and transforming them into larger monoclinic, which gets transformed. And the other ones which are in the line of the crack also start converting themselves into monoclinic. So therefore, the crack propagation therefore stops at that particular point of time. That's how zirconia behaves. And therefore, you should utilize this particular advantage and see to it that as far as possible, use monolithic zirconia as a monoblock, which is made into all your restorations. And because it works out wonders. And of course, lute it. When you choose your zirconia restorations and you want to think about luting it, though literature does say that you use a composite resin, remember one thing, a luting agent which is to be chosen for any restoration should be such that we should not undergo. We should be easy to retrieve the restoration easily. Therefore, use a glass ionomer-based cement, or to be more clearer and specific, I would choose a calcium aluminate type of cement. It's got a very good bonding to the tooth structure, and at the same time also lutes very well zirconia restorations, and both of them are smart enough. So therefore, use these combination of materials together to see to it that you work as smart prosthodontists. Coming to smart implant coatings, yes, we've got two of them, which have today in still research stages. One wherein you got antimicrobials, which are hydroxyapatite with a coating which has got silver antimicrobials, and the other one is diamond-like carbon and zinc nanoparticles. The mechanism, very simple. As your integration occurs, as your bone is getting response, the layer dissolves over the time. It releases the calcium and the phosphate and encourages the bone growth into the coating. Smart coating, because the rate at which the amorphous layer dissolves is tailored and to match the bone rate in each lost bone growth rate in each particular patient. So what they say is that why do you need this particular dissolution to occur? This dissolution occurs in response to that of bone which is growing. And the dissolution is specifically controlled to what we call as the local acidity which exists. In response to that of an infection or an inflammation, we know that the acidity goes down. That is, we have got a more acidic environment, the pH reduces, and therefore in response to this, the biomaterial, the smart, the coating releases the antimicrobials. The same is what we also do see with respect to that of DLC and zinc oxide, which is it's a very, very abrasion resistant material, and the same time is also kind enough that in response to that of a decrease in the pH, we got a release of zinc ions, or in the earlier case, the silver ions, which are lethal to that of the bacteria. So because of this, they have been seeing to it, because we do see that the moment we see that there is going to be a failure, or there is an inflammation, or there's pain, the immediate thing that we resort to is antibiotic. And with the antibiotic surge that is occurring, and with majority of the people with respect to pharmacologists and medicine guys, as well as with respect to oral surgeons, who today have come up to a point wherein they say restrict the use of antibiotics, we need to see and resort to such kinds of means that probably antibiotics need not be required at all, at least in the post-operative stage. And these particular mechanisms with respect to that of implant coatings can surely work on too. That brings me to the end of this particular presentation with respect to that of smart materials. I would end on this particular quote to say, to improve is to change. To be perfect is to change often. We need to think out of the box. And who else other than we as prosthodontists can do this? We are not new to change. The presentation, the conference, the convention itself is testimonial to telling us that we as prosthodontists are the best. And Indian prosthodontists are the best because we never get vulnerable to anything that attacks us. We always know how to think out of the box, and therefore see to it that we all use these smart materials. And as Shashikala Madam said, I hope the understanding, the mechanism of all these materials which behave smart, not act smart, they behave smart, together making a smart selection whenever we do our restorative prosthodontics, thus making us smart prosthodontists. With this, I thank you all. Thanks a lot to these organizers, as well as to the delegates, and of course my chairpersons and my moderator for a wonderful patient hearing. I hope I have been on time and seen to it that I did not, especially with respect to that of a dental material paper, it's always like that. You never go beyond the time, because you don't have much to write when it comes to that of dental materials. And therefore, I am sure that today, tomorrow, whenever there is an essay for you as students on smart dental materials, you would be doing justice to what I have spoken and you've heard. Thanks a lot. Thank you so much, organizing committee.
Thank you, Dr. Rajesh Sethuraman. It was a wonderful session. And chairpersons, would you like to ask him something? Say something about it?
Yes, Dr. Rajesh, was an excellent presentation. And it was the topic which is the need of an hour for our budding prosthodontists, because as you are also teaching PGs and we are also into PG teaching, nowadays PG students lack about their knowledge regarding the material. So it is definitely a need of an hour topic, and it was an excellent presentation. It's always a pleasure listening to you. Thank you so much.
Thank you, sir. Thank you so much.
Dr. Rajesh, it is definitely a very nice presentation and of an aspect which is least talked of. Whenever new material is introduced, we just go after it without actually looking into what it is actually giving and what was the previous material about. So you spoke smart.